As Florida continues to slowly reopen, some of the biggest concerns are how safe is it to be out and about and whether or not a second wave of coronavirus could hit Central Florida.
And morning anchor and health reporter Kirsten O'Connor is standing by now to ask a doctor.
Dr. Jeffrey Stalnaker is the chief physician executive at Health First, and I spoke with him over Zoom recently. He says as businesses reopen, one of the good things to come out of this is a lot more virtual doctor's visits. Right now, about half of their office visits are virtual compared to almost none before the pandemic. And he says patients are overall happy with that because they're more timely and convenient. But Dr. Stalnaker says right now, as many health officials have been saying, the doctor there in Brevard County is in recovery mode.
A lot of the different health officials have been kind of mentioning this recovery mode. So can you explain what that means for your hospital and for just the patients who will be coming and seeing and maybe hearing that? What does recovery mode mean?
So we're in what's called phase one of the President's White House task force, which our governor followed. And after being able to go through certain gates, so we've seen over 14 days of decreasing case rates of COVID and decreasing numbers of individuals that are coming to our emergency departments with COVID-like symptoms. Then, as he said, baby steps, we're able to begin to open up a little bit, still paying careful attention to social distancing and doing other preventative measures such as universal masking in our facilities, temperature checks, and that type of thing. And that helps to sort of open up things a little bit, but do it in a safe manner.
Are there certain procedures that you see moving forward that you mentioned the telehealth and those types of virtual visits, but are there other safety procedures that will continue even long after we stop talking about coronavirus?
Well, I think there are some things we should have been doing all along. You know, we have a flu season every year, and I think people take it for granted and sort of let their guard down. I think people are going to be much more aware now, and social distancing, particularly during times when infectious diseases are more common, I think people will pay much more attention to it.
And Dr. Stalnaker also talked about new technology being used in their hospital, including the Ease app, something I've actually been covering for years now inside some of the NICUs in Central Florida. It's an app that allows parents or family members to communicate with nurses caring for their loved ones, and it's helping with coronavirus patients at Health First.
Yeah, we were just implementing it before COVID started, and it was primarily to use in our ORs for better communication and where the surgeon could communicate with the family and so on as soon as the surgery was over. And then when COVID started, we sort of tried to ramp it up more quickly and use it more broadly.
Yeah, I'm so glad to hear that. Will you continue to use that app? Do you think that will be a piece of technology that, you know, we can say is a positive moving forward?
Absolutely.
So now the big question is, what about that second wave? Dr. Anthony Fauci, the nation's top infectious disease expert, warned Congress yesterday that if the country reopens too soon during the coronavirus pandemic, it will result in needless suffering and death. Dr. Stalnaker says caution should be taken, but his hospital will be ready if a second wave of the virus comes.
Everyone is talking about this second wave. Do you expect a second wave of coronavirus? And if so, how will doctors and hospitals react? And will it look similar to what we've seen so far?
Well, you know, national experts like Dr. Fauci say yes. I don't know, but we have our own task force here at Health First, and we monitor the numbers daily. And if we do see an increase in cases, we'll certainly be ready.
So Dr. Stalnaker says if you do need to see a doctor in person, Health First is safe. I've spoken with many doctors at this point all around Central Florida, and they all say if you have a problem that requires attention, please don't put it off because of coronavirus fears. As Dr. Stalnaker told me, if someone needs care, they're ready to provide it.